Hello, everyone. My name is Lucinda Ham. I'm the Quality Assurance Operations Manager for Missouri Cancer Registry and Research Center. And with me today, I have Stacy Barr. She is my WebPlus guru and our non-hospital coordinator. She's the one that sets up the displays that you will be using to abstract cases in WebPlus. So now let me go ahead and I will share my screen and we will walk through on how to abstract cases. Okay. Can you see my screen?
Yes.
Okay, thank you, Stacy. All right, so we will get started. The first place you want to go is the Missouri Cancer Registry and Research website, which is at cancerregistry.missouri.edu. And once you get in here, you can see where you can log into WebPlus. You can log in from the taskbar up here or from the button here. So let me just click that. And now it takes you to a WebPlus login page. And on this page, you will find some additional resources that you can use for abstracting cases. We do have a WebPlus PowerPoint that kind of goes through some of the slides and gives you tips on how to fill out the fields in the abstract. And then if you click on WebPlus Manual, it will open as a document, so you will have to open it up once it shows up. And this training manual was created by the CDC folks who were the developers of the WebPlus program. And so it has a lot of information in here, as you can see, from the basics to creating an abstract to adding an abstract to completing and releasing abstracts and so on. So that is a great resource for you to use and to look at. Also, there's a WebPlus quick reference guide. It's like a one-page tip sheet for abstracting that you can look at. And if you've not done so already, there is a WebPlus contact form that every user needs to complete before gaining access to WebPlus. I do want to point out that under the reporting tab, if you click on abstracting resources, we do have helpful resources out there for you to use. We have our MCR abstract code manual, which will soon be updated for the year that we're in. And then there's also like a zip code lookup. And so, for example, if you have a city and you don't know what county they're in, you can type in the city and the state, and it will tell you what county it's in. So that's a very helpful resource because it's very important that the correct county information is entered into the abstract. So from here, we can go ahead and click on the WebPlus login, and then it'll bring the button back, and we're going to go ahead and log into it. Oh, oh, too much in there. Okay. Okay. So a similar screen like this for you will pop up. It will have the name of your facility, and it may or may not have MO hospital reporting. If it has this, these are older cases that we have abstracted for your facility, and you can look back at those as a reference, and you can also see who's been reported. And so, but for today, we're going to focus on MOLV hospital, which stands for low volume. So just click on that, and then it brings you to this screen. It says welcome, and then click on new abstract to start a new abstract in WebPlus. So I'm just going to walk through and enter in a fake patient, and so you can see the steps and what you need to do. And so keep in mind, With most fields, there is a yellow information box out to the right, which tells you exactly what needs to be filled into the fields. Um, okay, and so I'm just going to go down and fill in as much information as I can. And always keep in mind that in WebPlus, the year has to be entered first, followed by the month, and then the date, and that's for any of the date fields. And so if you click on the boxes, as I said, it will tell you what you need to enter and what you can enter if you don't know. Like, for example, on this person, we don't know what the social security number is, so we're going to enter the 9s. If you have the phone number, please enter that. If you don't know what it is, you're going to enter the 9s. If the patient is of Medicare age, please enter the Medicare beneficiary ID number. And now we'll go on down to more patient demographics. For race, you can click the arrow and it will bring up a list of race codes where you can select the appropriate race for the patient. And then race 2, it's in there defaulted as 88. And if it will default to 88, otherwise, unless you have a mixed race, and then you would put that second race in there. For Spanish or Hispanic origin, click the drop down and you can choose the appropriate selection. For the patient's gender, if you click the drop down, you can select male, female, or whatever. And I do want to point out that all of these fields that have asterisks by them, those are critical fields and they must be completed. So we want to be able to get as much information we can so we can have a good abstract and be able to put that into our database. Okay, so moving on down, I'm going to say that this patient is single and never married. I'm going to say that he is a groundskeeper um, for the university. And then I'm going to put in an address for him and the city. And then you can use the drop down to find your state abbreviation. Or if you know it, you can just enter it in the box. And then please be sure and enter the 5-digit or 9-digit zip code. And then for the county, for example, if you did not know the name of the county, once you look it up in the zip code lookup, you could click on the spyglass. It will bring up a list. If it's in one of the other 4 pages, you can type in the county name and it will bring it up. So now that you have your county, if you click on the code, it will populate the field. The smoking status field is an NPCR required field, and so we have to fill that out. And I'm going to say this patient has never smoked. And then for alcohol history, tobacco history, and tobacco history years, those are Missouri specific fields, and we have to fill those out. That's information that we collect from Missouri. So I'm going to say that this person does use alcohol, but we already said he's not a smoker. And so for the tobacco years, we do have to fill it out. So if he was never a smoker, we would hit 00. If he was a smoker, you would hit the number of years that the patient has smoked or hit 99 for unknown. And so now our next field, we're going to get into more specific information. We're going to enter our date of first contact and using the year, month, and date format with no slashes. Okay, Next, we're going to enter our primary payer if we know that information. If you don't know, you can put insurance status unknown. If you know the physician's name, please put that in here. The spyglass really, that listing really does not work correctly, so I would ignore that. And then the place of diagnosis, enter the name of your facility. And if you don't know, enter unknown. So I'm just going to put MU for the University of Missouri. Okay, and the date of initial diagnosis is frequently the same date as the first date of contact. So I'm going to enter that in. And now that we have the initial date of diagnosis and the patient's age entered in here, if we click on the calculator, it would automatically calculate the patient's age for us. Okay, so for example, today, I'm going to say that this patient has a melanoma. And so if you click on the spyglass, if you type in melanoma, that's not really a primary site, right? I mean, it will bring up a list of codes, but really what you need to type in is skin, and then it'll also bring up a list of codes. And then to narrow that down, you want to hit space and then type in the body site. And then that will really narrow down the ICD code that you need to abstract. And then for the histology, now we can say this patient has melanoma. And as you can see, there's 4 pages of melanoma. So to narrow that down, we can put a space behind the word melanoma and type in part of the histology that the patient has. So we're going to say this patient has melanoma superficial spreading. Once we click on the code, it populates the field. And then now for the behavior, we have to determine by reading the path report whether the melanoma was in situ or malignant. So I'm going to pick malignant for this example. And then also be sure or be aware that we collect melanoma and Merkel cell and a couple other skin cancers, but we do not collect basal cell or squamous cell skin cancers. Now, if squamous cell is in another part of the body, then yes, we do collect that because that does occur. So for your text, document in the history and physical, document that information, the date of the exam, the age of the patient, the race, tumor size, and location. So we already know that we have like a 32-year-old white male. And he presented on 11/1 with a 1 centimeter lesion of his right back. Now, we'll say now it's bleeding and growing in size. So you can also look at your physician notes, and if you have the ability to copy and paste from your EMR, you can do that as well. It's very important to fill out these text boxes with as much information as possible. And so now moving on, for example, we'll say that because this was kind of a nasty looking lesion, the doctor ordered a CT scan. And so we'll say that that was done. Okay, and we're going to say that it was negative for metastatic disease. So in this box, you want to enter any pertinent imaging test performed, like they were checking for lymph node mets on this person or other mets. So be sure to enter any of that information that you might have in your EMR. And then moving on down to endoscopic procedures, this would not be applicable for a melanoma patient necessarily, but if you do GI lab or colonoscopies and EGDs at your facility, this is where you would enter in the date of those procedures and any findings that were found during those procedures, such as a polyp or a circumferential lesion of the sigmoid colon, or say, for example, if it was esophageal, you would describe what that lesion looked like, and you can get that from the operative report. And so one thing I do want to point out that I wanted to make sure you're aware of, the session time does start at like 60 minutes. So we've been working on this for 10 minutes, now 11 minutes already. And so you want to be sure and save periodically so that you don't lose any of the information that you've entered so far. And so I'm just going to click save. And it does show a good example of some of the critical fields that I haven't completed yet. Once you're finished with the abstract, you can print it out by hitting this little printer icon. So let's move on down to lab tests. Usually for each type of cancer, there's a specific lab test that's performed. And so for melanoma patients, it's the LDH test. And so you can you may know that already from your facility. If you're in a specific facility that looks for certain things. Otherwise, I mean, just be sure and enter any kind of special studies that might be contained in the EMR, other than WBCs and RBCs and stuff like that. But any kind of special test the physician ordered, it might be pertinent to the cancer diagnosis. Okay, for the pathology report, again, you start out with your date and you're going to document pertinent information from the path report. Again, if you can copy and paste the impression from your EMR, that would be great. So I'll start out by saying that a 1 centimeter and then I'm going to put in the Breslow thickness. That's something that they look for on melanoma cases. And Stacy, if you want to jump in and I know they look for mitoses as well.
Yeah, for a melanoma case that's invasive, the pathologist will have a CAP protocol, and we need pretty much all the information in that CAP protocol. It's important to note the Clark level, or it's also now being called the anatomic level. And then they'll note whether or not there was lymphovascular invasion, the mitoses, and then Breslow is very important, of course, and then margin status. They'll also put on there usually like PT1A or something in there, and you can note that in your notes as well.
Okay, thank you very much. Yeah, so there's a lot of information contained in the pathology reports that you need to enter into this section. It's very helpful because keep in mind, we are going to take this abstract and we are going to review it and populate it into a larger abstract and fill out additional fields. But we're trying to condense it so that it goes quick and easy for you as a reporter to report these cases. And so the next thing I'm going to enter is the primary site. And so once again, it won't be melanoma, but it will be skin. And then I'm going to put right back. And then the histology, you want to type it in. Okay, and then the staging, as Stacy said, you will generally get that from the path report. And if you don't have it, enter unknown. But generally, as Stacy said, you'll see something like a PT 1A, and then maybe perhaps an um, N0 for nodes, and then the M is usually not included on the path report because that's for metastatic disease, and that would be found more through CT scans or PET scans. But you would get your stage primarily from the pathology report, so enter as much of that information as you have available. And then for your surgery, describe all the surgical procedures, including dates performed as part of the treatment. So we're going to say this gentleman had a wide excision. And this is where copy and pasting comes in handy, if you can copy and paste that um, from your operative report. And be sure to include as much information and detail as you can in this area. For hormone therapy, it's probably not likely that a person would have hormone therapy for melanoma, so just put in A. And same with radiation. Um, it could be a person could have chemo or immunotherapy if they were node positive, but in this situation, they aren't. But if they were, you would want to enter the date, obviously, where the treatment was given, the type of chemotherapy, the name of the agent or the protocol they were on, and if they completed the information, or if it was perhaps it was ordered, but it was unknown if the patient went for the treatment. So it's very important that you enter as much information as possible. Same way with BRM, you would enter the agent, any kind of procedures, bone marrow transplant, stem cell, other treatment information. If the patient completed the treatment, if they, if they didn't or weren't able to because of maybe it was just too much of a treatment and they just, their body could not handle the treatment. So just include as much as you can for us. And like I said, we will take that and incorporate it into a bigger abstract. Under text remarks, include any miscellaneous details not recorded anyplace else. So like, you would include any kind of personal or family history of cancer, any complications not documented elsewhere, the place of birth. If the patient passed away, we would also want to know that here and the date. And now for SSDIs, as you can see, the two that are pertinent to melanoma popped up. And so if you click on the spyglass and scroll down a bit, it will show you what needs to be entered. And we said that this was 0.5. And then the LDH value, it was not collected for this case. So we'll enter that information. And if I click on the plus sign, it will show you many other SSDIs that are specific to other cancers, such as the prostate. You have the PSA and the Gleason's scores, and then brain tumors. P16, it goes for a lot of the squamous cell cancers of the head and neck, that type of thing. Breast, of course, is ERA, PRA, and HER2. So there's a lot of those that they will populate. The ones that you need to fill out will populate based on the site of the cancer. And so for treatment, you're going to put in your date of diagnostic procedure. And in this example, you would document if the patient had an excisional shave or punch biopsy first, and then they went back and had the wide excision. But in this case, the lesion was ugly enough and bad enough looking that the doctor just went ahead and excised it right then. And again, in these fields, you have to enter the year, the month, and the day in that order. And then the date the first treatment began would also be the same, as well as the surgery date. And then say, for example, maybe if this patient didn't have clear margins and then came back another time for a little bit more excision of that lesion, you would enter that date. If the patient had any palliative procedure care, you would enter that. Otherwise, just select 0 from the drop down. And since COVID is still around, we are still collecting that information. So if this patient's treatment was delayed because the patient had COVID, please enter that information in here. It's not required, but if you do have it and if it was a known problem to the patient, it would be beneficial. And then the last date of contact, we'll enter a date here. Maybe this is the date the patient had follow back with the physician or a follow-up visit for stitch removal or whatever, and that was the last time you've seen them. So please enter that in. And then for the cancer status, if all the margins were clear and everything was removed, you would click no evidence of this tumor. However, if you had a patient and maybe you just did a biopsy at your facility and that's all that was done, and you had to send the patient on for further care, you would select number 2 for evidence of this tumor. And so now that we have completed our abstract, I'm going to click save and we'll see if we have any edits that come up. And as you can see, there aren't any. And it's asking us if we want to release it or not. I would advise that if you're new at this, just select no and let Stacy or I know, and we'll be glad to go in and take a look at the abstract information that you entered and provide any feedback on what any changes that need to happen before you do release it. And then that would give you an opportunity to go back and do that. So, and then I wanted to also point out after I click save, the session time starts back over at 60 minutes. So it's very important to save frequently, especially if you're in a setting where you might have interruptions, and that way your work is not lost. So let's say that I think you've seen how the edits work, but let me take out a field and I'll click save again. And as you can see, it'll bring up an edit for that critical field, or you can click run edits and you'll get the same information. If you click on the brown text, it'll take you directly to the field. It goes to the top, and then you can enter in your information. Okay, now I'm going to run edits again. And now as you can see, the edit disappeared. So that means all the critical fields are complete and it's ready to release if you're confident that you have everything filled out correctly. Otherwise, we'll be glad to take a look at it. Okay, so let's say you're all done with that abstract, or you want to see where you're at in abstracting and how many have been done. Click Find Open Abstract and Find, and it'll bring up a list of all the cases that are in there. And you can sort this list in different ways. You can sort it by last name, birth date, primary site, and status. So if you click status, it'll show the incomplete ones at the top, or vice versa, it'll change it around. And that way you know which ones you need to go back and finish. And then let's see, if you, once you're all done, you can go to release abstracts. Say, for example, if you did several of them and we've looked at them, um, or you're seasoned and you're confident in what you have in there, you can select all, or you can select one or two, and then you can release the selected abstracts. Um, or select all, unselect all. And then I do want to point out, if you do want us to look at an abstract, do not email any PHI, but send us this ABS ref ID number, and then we can go in and find the case and take a look at it and then provide you any feedback. And so I think that almost concludes our presentation. Stacy, do you have anything to add?
I think you covered almost everything. We just want to emphasize the importance of text fields in your abstracting so that we can complete the text here at the registry. Or, I'm sorry, complete the abstracts here at the registry.
Right. Yes, absolutely. Yes, because if you do have that, um, the Mo hospital reporting, you can see there's a huge difference in the number of fields that we have here compared to those. And so it's very important that you fill in the text as much as possible so we can take and fill in the fields in the larger abstract. So again, once you're ready to release it, you can select yes, and then you will be done with that. So thank you for taking the time to listen to our presentation today. And again, reach out to Stacy or I if you have any questions at all. Thank you very much.